Bismillahirrahmanirrahim. Assalamu alaikum warahmatullahi wabarakatuh. We are discussing MRI of the knee. This is axial fat suppression T2 weighted sequence. This is axial T2 weighted sequence. This one is coronal T2 weighted sequence, and this is coronal T2 fat suppression sequence. And here we can see sagittal T2 weighted sequence. This is the area of posterior root of posterior horn of the medial meniscus, and this is posterior horn of the medial meniscus, and this is the area of posterior root, and this is the focus where it should attach. As we can see, the posterior horn of the lateral meniscus and its posterior root. So abnormal increased signals are noted in this region, suggesting radial tear, and we can confirm this on sagittal image as well. And this is the area where we can see torn posterior root of posterior horn of the medial meniscus. Here we can see, and we can also confirm this on axial images. This is anterior horn, body and posterior horn, and this is the root of the posterior horn, and we can see a radial tear passing through and through this region. This can also be confirmed on axial T2 fat suppression sequence. This focus is detached from the main posterior root. We can also see subchondral bone ulcer immediately below this posterior root torn area. We can see this is an example of radial tear involving posterior root of the medial meniscus at the level of its bony attachment. We can also see there is a thin strip of joint effusion which appears reactive in nature, while there is evidence of thinning of retropatellar cartilage, especially over medial patellar facet, and we can also see tiny subchondral bone ulcers, suggesting grade 3 to 4 chondromalacic changes in this region. So here we can see ACL and PCL appears normal, while grade 3 to 4 chondromalacic changes are noted in retropatellar cartilage. A very tiny strip of fluid is appreciated in prepatellar bursa. Generally, quadriceps and patellar tendons appears unremarkable. Similarly, we can see medial and lateral collateral complexes are normal as well. ACL and PCL is unremarkable, the normal lateral meniscus. Thank you very much. Assalamu alaikum warahmatullah.